Have you ever noticed the shape or color of your stool? Most people ignore it, but what if I told you these small signals could be the first warning of something serious? Especially for seniors, one particular stool type, narrow, thin, or unusually hard or soft, could be a sign of cancer. And it's not just about stool. Blood, unexplained weight loss, or persistent fatigue might be happening too. Don't panic, but don't wait. Early action, simple screenings, and paying attention to your body can literally save your life. Listen to your body. Take action today, because knowing and acting early isn't just smart, it could be life-saving. When it comes to senior health, one of the most overlooked yet vital indicators of wellness is the state of your bowel movements. Many people dismiss changes in their stool as minor digestive issues, aging, or the result of something they ate, but in reality, persistent or unusual changes can sometimes signal serious underlying health conditions, including colorectal cancer. It's important to understand that stool isn't just waste. It's a reflection of how your digestive system is functioning, how your diet and lifestyle are impacting your body, and how effectively your body is eliminating toxins. As we age, our bodies naturally experience shifts in digestive efficiency, and this makes monitoring stool even more critical for seniors. Changes in stool can manifest in several ways. Consistency, color, shape, and frequency can all provide valuable clues. For example, if your stool becomes unusually narrow, resembling a pencil, or if it is consistently hard or very loose, this can be a warning sign that something is affecting the colon. These changes should not be ignored, particularly when they persist over weeks rather than days. While occasional irregularity can be caused by diet, hydration, or temporary stress, persistent changes are what doctors warn us about because they may indicate obstruction, inflammation, or the presence of polyps in the colon, some of which can turn cancerous if left untreated. Understanding why these changes happen requires looking at the digestive system as a whole. The colon plays a crucial role in absorbing water and nutrients from food and forming stool. When tumors or abnormal growths develop in the colon, they can narrow the passage through which stool passes, causing it to take on an unusually thin or ribbon-like appearance. In addition, tumors can cause bleeding within the colon, which may lead to stool that appears darker, black, or even mixed with blood. For seniors, these signals are particularly significant because the risk of colorectal cancer increases with age. Research shows that the majority of colorectal cancer cases are diagnosed in people over the age of 50, making regular attention to bowel habits a vital part of preventive health care. Ignoring these changes or dismissing them as a normal part of aging can delay diagnosis and reduce the effectiveness of treatment. Equally important is the need to observe patterns over time. One isolated change may not indicate cancer, but a consistent pattern of stool changes, such as persistent narrowing, alternating constipation and diarrhea, or changes accompanied by discomfort, should raise concern. Seniors should track their bowel habits, noting not only the shape and consistency, but also color and frequency. Keeping a simple diary can help provide a clearer picture for healthcare providers. When presenting this information to a doctor, having detailed records allows for a more accurate assessment and can prompt timely diagnostic procedures like colonoscopy or imaging studies. Early detection is key because colorectal cancer often develops slowly over several years, and identifying it in its early stages dramatically increases the chances of successful treatment and recovery. It's also important to understand that stool changes alone are not the only warning sign. Symptoms such as unexplained weight loss, persistent abdominal discomfort, fatigue, or anemia can accompany abnormal stool and should heighten vigilance. While it may feel uncomfortable to discuss these issues, seniors must prioritize open communication with their healthcare providers. This proactive approach can save lives. By paying close attention to what your body is telling you, you are taking control of your health and helping prevent potential complications before they become life-threatening. Awareness and education are crucial. Many seniors may not realize the connection between stool changes and serious health conditions, but understanding this link empowers individuals to take timely action. A healthy lifestyle, including a balanced diet rich in fiber, adequate hydration, regular physical activity, and limiting processed foods, supports normal bowel function and reduces cancer risk. However, lifestyle alone is not a guarantee, which is why monitoring stool changes and seeking medical advice when abnormalities persist is essential. No one should ignore the messages their body sends, and seniors in particular must treat these signals seriously. Vigilance, awareness, and prompt action form the cornerstone of preventing colorectal cancer and maintaining digestive health as we age. Being attentive to your stool is more than just a habit, it's a vital practice in proactive senior health, one that can make the difference between early intervention and delayed treatment. One of the most important aspects of understanding your health as a senior is recognizing the specific stool types that may indicate a problem. While occasional changes in bowel movements are normal, certain persistent patterns should never be ignored. For instance, a stool that appears unusually narrow, sometimes described as pencil-like, is a classic warning sign that something could be obstructing the colon. This narrowing can result from polyps, tumors, or other growths that partially block the bowel, making it difficult for stool to pass normally. Over time, if these growths are left untreated, they can develop into colorectal cancer, which is why recognizing this stool type early is so crucial. Similarly, very hard, lumpy stools that are difficult to pass or very loose, watery stools that persist beyond a couple of days can both indicate that your digestive system is under stress and may be affected by an underlying disease. Seniors, in particular, are more susceptible to these warning signs because age-related changes in digestion and slower bowel transit can amplify symptoms. It's also essential to pay attention to subtle changes that might otherwise be overlooked. The color of your stool can provide clues about your health. Dark tarry stools or stools streaked with blood are indicators of internal bleeding in the gastrointestinal tract and should prompt immediate medical consultation. Likewise, pale, clay-colored stools can signal problems with the liver or bile ducts, which are linked to digestive and systemic health issues. Frequency matters as well. If you notice sudden changes in how often you have bowel movements, especially when combined with stool shape or color changes, this could be an early sign that your colon is struggling to function properly. Seniors should view these stool types not just as minor digestive issues, but as signals from their body. The colon is responsible for processing waste, absorbing water, and maintaining a delicate balance of gut bacteria. When abnormal stool types appear, it indicates that this balance may be disrupted, either by structural changes, inflammation, or other health conditions. By recognizing and acting on these warning signs, seniors give themselves the best chance for early detection and treatment. Keeping a log of bowel habits, including stool type, color, consistency, and frequency, provides invaluable information for healthcare providers. This proactive approach allows doctors to make informed decisions and recommend timely screenings like colonoscopies, which can detect and remove polyps before they become cancerous. Ultimately, understanding the stool type to watch for is not about fear, but about awareness. Paying attention to these changes empowers seniors to take charge of their health. It transforms what might seem like a private, everyday bodily function into a vital tool for early detection and prevention. By recognizing the signs, monitoring patterns, and seeking medical advice when necessary, seniors can act before small issues become serious, potentially saving lives and preserving quality of life well into older age. Alongside changes in stool, there are several other warning signs that seniors should be aware of, as these often appear together and can provide a clearer picture of potential health issues. One of the most common indicators is the presence of blood in the stool. This can appear as bright red streaks or darker tar-like stool, depending on where the bleeding occurs in the digestive tract. While occasional minor bleeding may result from hemorrhoids or minor anal fissures, persistent or unexplained bleeding is a red flag that should never be ignored. Another important symptom is unexplained weight loss. Seniors who find themselves losing weight without changes in diet or activity level may be experiencing a systemic effect of an underlying condition, including cancer, which is affecting their metabolism or nutrient absorption. Persistent abdominal discomfort or cramping is also a critical warning sign. This may present as bloating, gas, or localized pain in the lower abdomen. These sensations can indicate inflammation, obstruction, or abnormal growths in the colon, which can interfere with normal digestion and bowel movements. Fatigue is another common symptom that often accompanies abnormal stool or internal bleeding. When the body is losing blood or nutrients due to undetected issues in the digestive tract, it can lead to anemia, causing weakness, lethargy, and difficulty performing daily activities. Seniors should pay particular attention when fatigue is unexplained and persistent, as it may be a subtle but significant sign that warrants evaluation. Changes in bowel habits themselves, such as alternating constipation and diarrhea, sudden increases or decreases in frequency, or incomplete evacuation, can also indicate that something is affecting the colon. The combination of these symptoms with abnormal stool types strengthens the likelihood that there may be a serious underlying problem. Seniors should not attempt to self-diagnose or dismiss these signs as normal aging. Instead, observing the pattern, noting when and how frequently symptoms occur, and reporting them accurately to a healthcare provider is essential. It's also important to consider how lifestyle factors intersect with these warning signs. Diet, hydration, and physical activity can influence bowel function, but persistent symptoms despite maintaining healthy habits suggest the need for professional evaluation. The key message for seniors is that while one symptom may not be cause for alarm, the combination of stool changes, blood in stool, abdominal discomfort, fatigue, unexplained weight loss, and changes in bowel habits collectively signals the importance of timely medical attention. Recognizing these warning signs early allows for prompt screening, accurate diagnosis, and interventions that can prevent minor issues from escalating into serious health problems. By being aware of these additional warning signs and acting on them, seniors take an active role in protecting their health and reducing the risk of complications. Vigilance, awareness, and early intervention can make a profound difference in outcomes and overall well-being. Early detection through preventive screening is one of the most powerful tools seniors have to protect themselves against colorectal cancer. Even when stool changes or other warning signs appear, timely screenings like colonoscopies, fecal occult blood tests, and stool DNA tests can identify abnormal growths, polyps, or early-stage cancers before they progress. Colonoscopy, in particular, is considered the gold standard because it allows doctors not only to detect irregularities but also to remove polyps immediately during the procedure, preventing them from becoming cancerous. For seniors, adhering to recommended screening schedules is critical, as the risk of colorectal cancer increases with age, and early-stage detection dramatically improves treatment success rates. Many seniors may hesitate to undergo these tests due to fear, discomfort, or a lack of awareness about their importance. However, understanding that these screenings are proactive measures rather than reactive treatments can change that perspective. Colon cancer often develops silently over several years, and symptoms like stool changes or fatigue may not appear until the disease has progressed. By investing a small amount of time in preventive screenings, seniors gain peace of mind, potentially life-saving information, and the ability to address problems before they become more serious. It is equally important for seniors to combine screenings with regular discussions with their healthcare providers. Providing detailed information about bowel habits, changes in stool, or other symptoms helps doctors make accurate assessments and recommend the most appropriate tests. Even if initial results are normal, routine follow-ups are essential because colon health can change over time, and early intervention remains the key to successful outcomes. Preventive screening also plays a role beyond detecting cancer. It can uncover other gastrointestinal conditions such as diverticulosis, inflammatory bowel disease, or polyps that might otherwise go unnoticed. Identifying these conditions early allows for management strategies that can prevent complications, improve digestion, and enhance overall quality of life. Seniors who maintain regular screenings demonstrate a commitment to their health that empowers them to live actively and confidently, knowing they are taking steps to reduce risks. By prioritizing preventive screening and early detection, seniors are not only monitoring for cancer but taking control of their digestive health. It is a simple yet profoundly effective way to ensure that changes in stool or other subtle symptoms are evaluated and addressed promptly, giving seniors the best chance for a long, healthy life. Maintaining a healthy lifestyle plays a crucial role in supporting colon health and reducing the risk of colorectal issues for seniors. Diet, in particular, is one of the most powerful tools available. Consuming a diet rich in fiber from fruits, vegetables, whole grains, and legumes helps keep bowel movements regular, softens stool, and reduces pressure on the colon. Fiber also nourishes beneficial gut bacteria, which support digestion and immune function, creating an environment that discourages the growth of abnormal cells. Seniors should aim to include a variety of colorful vegetables and fruits, as these provide essential vitamins, minerals, and antioxidants that help protect cells from damage and inflammation, both of which can contribute to cancer development. Hydration is equally important. Adequate water intake keeps the digestive system functioning smoothly and prevents constipation, which can exacerbate strain on the colon. Seniors often experience decreased thirst perception, making it essential to consciously drink enough water throughout the day. Regular physical activity also supports digestive health by stimulating intestinal movement, improving circulation, and enhancing overall metabolism. Simple exercises like walking, yoga, or light strength training can make a significant difference in bowel regularity and overall well-being. Lifestyle factors extend beyond diet and exercise. Limiting the consumption of processed foods, red and processed meats, and foods high in sugar can reduce inflammation and lower the risk of colon-related problems. Additionally, avoiding smoking and minimizing alcohol intake are critical preventive measures, as both have been linked to higher rates of colorectal cancer. Even modest changes in these areas can have a significant impact over time, especially when combined with regular screenings and attention to stool changes. Equally important is stress management. Chronic stress can disrupt digestion, alter bowel habits, and contribute to inflammation. Seniors can benefit from mindfulness practices, meditation, breathing exercises, or engaging in hobbies that bring joy and relaxation. Prioritizing mental well-being supports the digestive system and enhances overall health. By adopting these healthy lifestyle habits, seniors not only improve digestion but also strengthen their resilience against serious conditions like colorectal cancer. While no lifestyle change guarantees absolute prevention, these strategies work together to maintain colon health, support regular bowel function, and reduce risk factors. Simple, consistent steps taken every day can make a profound difference in long-term wellness, giving seniors a proactive approach to preserving their health and quality of life. Taking action promptly is the final and most critical step in protecting colon health as a senior. Recognizing changes in stool, unusual bowel habits, or other warning signs is only effective if followed by timely medical consultation. Seniors should not wait for symptoms to worsen or assume that these changes are just a normal part of aging. The moment persistent changes appear, whether it's narrow or ribbon-like stool, blood in the stool, unexplained fatigue, or abdominal discomfort, it's essential to contact a healthcare provider. Early consultation allows doctors to perform the necessary diagnostic tests, interpret results accurately, and recommend treatment options before any condition progresses. Tracking bowel habits in detail can be incredibly helpful when seeking medical advice. Keeping a record of stool type, consistency, color, frequency, and associated symptoms like pain or bloating provides valuable information for healthcare professionals. This proactive approach enables more precise assessment and reduces the risk of misdiagnosis. Seniors should also be aware of their family history, as a history of colorectal cancer or polyps increases risk, making timely action even more critical. In addition to monitoring and reporting symptoms, seniors should be familiar with preventive screenings and follow recommended schedules for colonoscopies, stool tests, and other relevant evaluations. Even if symptoms are mild or intermittent, screenings can detect potential problems that are not yet causing obvious signs. Combining vigilant monitoring with routine preventive care ensures that any issues are identified and addressed early.